Packing up, getting out of town sounds like a great idea, and it can be if you do it wisely during the pandemic. Sarah, before she was off today, talked to a doctor at Holston Medical Group for some tips on safer travel during the pandemic.
Dr. Brian Enriquez, an urgent care physician for Holston Medical Group, says traveling abroad can pose an extra risk. He says medical care may not be as readily accessible as it is in the United States, and traveling to a faraway destination by plane where others have sat before can also up your odds of getting sick. And coming back home may be difficult.
U.S. residents might have a more difficult time returning upon their attempt to get back if there is an uptick in cases.
Once you get to your destination, make sure those high-touch surfaces are clean.
Keeping some Lysol wipes with you and wiping down commonly used things, the remote control in the hotel room or anything like that, that is a very simple thing you can do to reduce the likelihood of catching illness.
If you do get sick or injured, Dr. Enriquez recommends using an urgent care.
They're a wonderful alternative to the emergency room, cost-wise. And they're great places to receive care quickly.
And don't forget about telehealth.
A lot of doctors are doing telemedicine visits. So there's an opportunity there that you might be able to speak to your own doctor while you're away. So it never hurts to give your own personal doctor a call to see if you can do a virtual visit just like this one.
Enriquez adds that even with the stress of the pandemic, it's still important to have fun.
Vacation is a wonderful time to relax and enjoy yourself. And I still think that's a thing that we all can do, but just take a couple extra steps to keep you and your family safe.
Some great practical advice, some other tips. Research your travel destination for that local COVID-19 risk before you go. You should wear a face covering. According to health officials, that is the guidance, and avoid large groups of people. And health experts are adding you should monitor yourself for symptoms for at least 14 days after you come home, limiting your exposure to others for a while until you make sure that you came home with nothing by way of a virus. Looking out for those high risk and for those who might really be vulnerable to severe symptoms.